Like and subscribe and click the bell icon to get new video updates.
Covered in WA, no more masks as most virus restrictions ease across the state. Masks are gone, so too are capacity limits and vaccine-proof requirements in a milestone day for WA's response to the COVID-19 pandemic. From midnight, a raft of restrictions eased across the state, a move long campaigned for by hospitality groups and others after they were instituted 3 months ago. It's hoped the changes will herald the return of thousands of workers to the city's CBD. Rest in peace, work from home, those days are over, Perth Mayor Basil Ziempilas told The West Australian. I'm extremely optimistic that beginning Friday and then ramping up next week, we will see a return to traditional work practices, and that means city workers at their desks. Hours before the restrictions eased, WA Health announced a further 7 covered deaths and 89 new cases, bringing the state's active caseload down to 43,118 from 45,008 in Monday's reporting period. The Premier, who emerged from isolation on Thursday after testing positive to COVID-19, marked the milestone by thanking Western Australians, saying it was a result of their sacrifices that the state had passed the Omicron peak and achieved the planned soft landing. That in turn is the result of your hard work, doing the right thing now for over 2 years, whether that was following the health protocols, staying home when you're unwell, and especially getting vaccinated, Mark McGowan wrote in a Facebook post. WA is now one of the most highly vaccinated places in the world, and it's making all the difference in keeping Western Australians out of hospital. It means the health advice says that WA is now in a position to ease those measures safely. Mr. McGowan said while many measures had been lifted, some still remained, and warned that just because people are no longer required to wear a mask in most places, doesn't mean the pandemic is over. While COVID-19 no longer threatens to overwhelm our hospitals or our community, it is still a serious illness and needs to be taken seriously, he said. Many Western Australians remain vulnerable, whether they're older or immunocompromised. It can still result in severe illness, long COVID and, tragically, death. Mr. McGowan earlier this week confirmed the contentious vaccine mandate covering more than 1 million workers in WA will remain until the third dose vaccination rate reaches way over 80%. The no jab, no job policy, which applies to 75% of the workforce, is one of the few restrictions set to stay. The Premier also confirmed the state of emergency declaration, which is renewed every 2 weeks with the stroke of pen, would continue. He said the extraordinary powers were required so the remaining baseline restrictions, such as compulsory mask wearing in hospitals and on public transport plus restrictions on the movements of cruise ships, could be enforced. The new rules gone, proof of vaccination to enter businesses and venues, proof of vaccination for interstate travellers, G2G passes for all travellers into WA, third vaccine requirement, capacity and gathering limits, and the 2 square metre rule, caps on weddings or funerals, capacity limits on community sports, stadiums and community events, blanket indoor mask mandate, masks for people aged 12 and over visiting or working in aged care, healthcare buildings and hospitals or prisons, as well as travelling in taxis, rideshare or on public transport still required, masks for children aged 8 to 11, quarantine requirements for asymptomatic close contacts, however they will still need to wear face masks, take daily RAT tests and avoid high-risk settings, staying, employment mandates for unvaccinated workers, masks for people aged 12 and over visiting or working in aged care, healthcare buildings and hospitals or prisons, as well as travelling in taxis, rideshare or on public transport, international vaccination requirements, as instructed by the Commonwealth, 7-day quarantine for unvaccinated travellers entering WA, restricted travel to Indigenous communities, masks and at least 2 vaccinations for healthcare visits.